Why? It's for obvious reasons. They want our young pharmacists to be equipped, fully equipped in supply chain. Prior to this, very few pharmacists know about logistics and supply chain. But the main reason of creating young pharmacists is to equip our young pharmacists in supply chain and to be well connected. We all know that now in Nigeria you have to be politically inclined, otherwise your profession will be left behind. And thank God, now many young pharmacists have now moved into politics and they are doing very well. And then the second reason why young pharmacists group is created is to become effective agent of change and policy and policy influences. Now I want you to ask yourself, how many policies across the country have you influenced in changing? You know, there was a time as a pharmacist, I'm sorry you are listening, even in the hospital setting, nobody talk of you. It's true or not true? During our time, around 1991, 92, 93, up to 2000, you can't even post or do a pharmacist in the hospital setting because nobody recognizes you. But thank God, now pharmacists are one of the people that are well connected to the hospital setting, and it's for obvious reasons. And then that is why we now want you to be more into the various aspects of pharmacy profession, so that you uplift the pharmacy profession. Thank you very much. And then going along the slide, so I will take us into the context of what are the gaps? What are the gaps in our pharmaceutical supply chain across the country? And before we go into that, I think it is good that we should take a little on logistics and supply chain. Every time you hear about logistics, you must hear about supply chain. As I said, this is the topic, that supply chain gaps in Nigeria, how young pharmacists can leverage in interacting with pharma group to make our supply chain effective across the country. Okay, yeah. So, how young pharmacists leverage on pharma companies to access quality and effective medication. As a pharmacist, if you cannot influence making access available quality and affordable medication, they won't like you. No matter the aspect of pharmacy, whether you are an industrial pharmacist, you are a hospital pharmacist, you are a community pharmacist, or you are an academic pharmacist, the ultimate aim is to make drugs readily available and accessible across the country. Next slide. So now, my presentation outline, I will talk a little introduction on logistics and supply chain, because that is key for you to understand why you need to do the other, what are the gaps. If you don't know about supply chain and logistics, then how do you know about the gaps? So even though that, then we now explain what are the current gaps and inefficiencies in the Nigerian pharmaceutical supply chain. That's also very key. We need to understand that and then itemize individual gaps, and then we will now move ahead. Then what are the strategic roles that young pharmacists will do in optimizing our supply chain? A lot of things are now happening across the country. But before then, as I have said, we are virtually nothing. But now, a lot of partners, RSA are around. They have gone around a lot of things across the country, and then many other partners are there. They are now moving there. So, having knows about the role that we are supposed to play in optimizing the nation's supply chain, then again, we will now look into practical examples on how pharmacists can engage with pharma companies in terms of areas of research, in terms of regulation, and then ethical marketing. You know, now, we that are at the DNA, we see a lot of things. Young pharmacists from different companies will come and be marketing their product. Some of the marketing, you know, some will do. But what we want is ethical marketing. Yes, And then after that, then we will now see what are the impact of those gaps that we were able to itemize. What are the gaps, what those gaps created in terms of making access of quality, available, and accessible medication in countries. So these are the presentation outline. I will go through them one after another. Next, now, as an introduction, what is logistics? Anytime you hear logistics, you hear supply chain. Anytime you hear supply chain, you will hear logistics. Some people even assume that logistics and supply chain are the same one, but they are not, they are different. So we are going to see what are the differences. Logistics is the planning, implementation, and control of the movement of goods and services and information from the point of origin to the point of consumption. That's all about logistics. Whatever you are going to do to move commodities from the point of origin to the point of consumption is logistics. There are a lot of factors that affect logistics, such as adaptability and such as policies. Any logistics that cannot adapt itself with policies, then logistics is weak. Before now, we don't have a strong logistics, but with the evolution of DMAs, now we have a strong logistics across states. In 36 states, we have 24 states now with DMAs. For the remaining, it is about 14, about 12. 24 states have a robust DMAs, even though the maturity of the DMAs varies from one state to another. I'm sure, Peter, you will bear with me that the maturity of DMAs varies from one state to another. RSM, through National Priority Management Program, has been assessing many DMAs and see the maturity level. Some of them are at rudimentary level, some of them are at emerging level, some of them are at maturing but not ready to integrate, while some at the level of maturing and ready to integrate, and some are mature. Even though up to now, no DMA across the country have fully mature, right? There are some of them, only about 2 or 3 that reach maturing and ready to integrate. But most of them are either at rudimentary level or emerging level. So that is very important. And that's about the logistics. And what are the key functions of logistics? Key component. Number 1 is transportation. For you to have a very sound logistics system, you must have a very sound transportation system. And then you have to have even route optimization, route planning for you to be able to have a very good transportation system. Next is warehousing. Warehousing is a very important component of logistics. Without good warehousing, then your logistics has issues. Thank God to Global Fund, through National Priority Management Program, now they were able to construct about 18 farmer grades across the country, of which Kano was opportune to have one, Plateau was opportune to have one, Kaduna was opportune to have one, Yoda was opportune to have one, Nasarawa. So at least now we can both of having a farmer grade. When I say a farmer grade, yes, a farmer grade that is of world standard. You can warehouse any crop there. Both dry crops and then whole chain crop. You can warehouse them there. So that is inventory management. And inventory management in logistics is very critical. If you don't know how to manage your inventory, if you don't know how to control your inventory, then there will be a problem. A very good inventory system is an inventory that you will prevent stock out, and then you will prevent also excess stock that will lead to expiry. And then stock out, of course, it will limit to not getting access to growth, while excess stock will lead to expiry. And then once you have that, then your logistics system is not all that good. And then the next component is order fulfillment. Order fulfillment is your ability to fulfill the requirement of your customer. So a good logistics system is one that can fulfill the requirement of his customer. Now the DMAs that are evolving, if a DMA is not able to satisfy the requirement of its facility, then that DMA will have a problem. So order fulfillment is a very critical, in fact, it's one of the KPI that will measure logistics. That is key performance indicator. If an organization in terms of supply chain cannot fulfill the requirement of its customer, then there's a problem. Then next is packaging and handling. In private sector across the country now, we have seen a lot of revolution in terms of private sector. Now we have over 120 manufacturers across the country, and they're doing very well. But in the public sector, I think apart from Zamfara and Kano, there's no GMA that is doing manufacturing. Even though most of the GMA is in the road to start manufacturing. Kano, for more than 20 years, we have been into manufacturing. Even though the manufacturing is not all that encouraging, but however, now we are trying to revive that, to move with time. And then that is how every GMA is supposed to come. And then the next component is what? Distribution. You need to have a very good distribution network. And that is why in any state that we created GMA, we advise they should have a zonal warehouses. I think across the country now, apart from Jigawa, Kano, Yobe, Nasarawa, there's no state that has a zonal warehouse. Why do we advocate for having zonal warehouse? Is to reduce travel time. Imagine, for example, in Kano, a facility at Gogwa, almost 250 kilometers to access drugs. So that's why with zonal warehouses, we decentralize the DMS into different zones. And we cluster LGS, and then for them to have that zonal warehouse to increase access to that medication. So these are the components of logistics, and they are very key and important. Then let's look at supply chain. For supply chain, it's a broader concept than logistics. It involves the entire network of entities, the peoples, the activities, and then all the information, the resources, and then the other components of logistics that I mentioned earlier. They are all part of the supply chain. So these are them, and then they involve them in the supply chain. So supply chain is a broader concept than logistics, because the resources are there, human resources are there, and then activities that are even need to be carried out as part of supply chain. If you don't have a good planned activities to carry out your supply chain, then you will have problems. So that is why supply chain is a broader concept of logistics. Let's see the component of the supply chain. Number one is sourcing and procurement. In logistics, we didn't talk about procurement because it's not part of logistics. But in supply chain, procurement is key. And procurement is one of the key factors that affect supply chain, more especially not at private, but at public. If you see any DMA that doesn't have a well-defined procurement system, they have problems. And that is why most of the DMA that are evolving, they don't have the methods of procurement, they don't have the methods of sourcing, where even to source, who are the strategic suppliers, what are the strategic commodities. So, but then thank God, RFM now came, and then they now develop what they call PPP, where they partner the DMAs and then the private pharmaceutical group, so that they now support them to develop an MOU where the DMA will get access to quality drugs at affordable prices. So, but gradually, DMAs that have developed, they now go into another form of procurement, which is the tendering processes. I think now across the country, it's only Kano and Nasarawa state that are doing that. Because the tender is the most standard procurement system across the world. Even though now the PPP is doing very well, and then the direct procurement is also doing very well, but in Kano, we do the three. We have our PPP, sanctioned by Act, we have our direct procurement for those companies that are not part of the farmer group, and then we have our tender procurement processes, which is very elaborate. So that is one of the components of supply chain. The second component is manufacturing. So manufacturing also play a role in supply chain. How does our pharmaceutical industry were able to manufacture? What are they manufacturing? And then how do they manufacture? Do they have the capacity to manufacture to satisfy the need of the nation? And then what are the quality of the drugs they are manufacturing? And then what are the prices of that manufactured commodity? So all those are part of the supply chain component. And then next is logistics. As you can see, even logistics now now fit into supply chain. So the 7 components that I mentioned for logistics, they are part here. And then distribution, and then of course customer services. So supply chain is even good enough to look at how you service your customer. It's not about selling drugs, but what are the quality of services that you have rendered to that your customer. So this is about supply chain. Whatever I'm going to say, it is within logistics of supply chain. So that's why I say, let me give you an introduction of that. So next slide. Now, coming to the real topic, what are the gaps that affect our pharma supply chain in Nigeria? Number one is what is fragmented and unprotected supply chain. But thank God, with the involvement of National Product Supply Chain Management Program, they have done a lot of work. Now, we are getting at the verge of integrating our supply chain. I think our priority has a workshop, right? In Lagos very soon. So that will now pave way for integration. Before now, you go to a state, you see different commodities were handled differently. Malaria commodity handled differently, HIV/AIDS, TB and leprosy, family planning, immunization, and essential medicine. They are all managed separately, they are warehoused separately, they are transported separately. And by doing so, what are we doing? We are wasting resources. We are wasting man-hour. Instead of one person to manage this commodity, you are now hiring many people to manage this commodity. And that's why we keep on trying that human resource for help, much training in the pharmaceutical sector, we are not adequate. Yes, agree. But if we can manage our human resource very well, and then we integrate our commodity very well, you see that we have more hands to carry out other activities. So, uncoordinated and fragmented supply chain is key. Lack of central coordination between federal, state, and local level play a role. But now, with National Product Supply Chain Management Program, they are doing very well. It's not an agency. It's a unit within the Department of Drug and Food of the Federal Ministry of Health. They are now responsible for coordinating the national supply chain, and they are doing good. In fact, they are the ones that champion the involvement of the DMA. Before them, across the country, we have only 3 DMAs, that of Jigawa, Kaduna, and Kano. But now, with them and with other partners and other donors, we now have 24 DMAs across the country. So now we are coordinating our supply chain. And then, poor integration between public and private sector stakeholders. With the PPP that act as championing now, we started having that coordination. But before then, there's no much coordination between the private sector and then the public sector. So, the next is what? With regulatory and quality assurance system. We know we have that, we have Pharmacy Council of Nigeria and other regulatory agencies. But they are doing good. However, it's not enough. There are weak regulation, and that's why we now go out there and see a lot of fake drugs, fake counterfeit and adulterated drugs. The state that suffer most in terms of those fake is Anambra State and Kano State. But in Kano State now, with the advent of the Ngoro market and then the ban of Southern Daily Market, we are able to control that to some extent. However, faking is still rising across the country. So, and then circulation of substances, as I have mentioned, and then weak post-marketing surveillance and product traceability system. Our pharma group, once they have launched their product, is entered the market, then there is weak post-marketing surveillance. They're supposed to be doing post-marketing surveillance so that they will be able to differentiate, even if there is fake drugs similar to their own, they will be able to trace it. There was a time in Kano when we got augmented Zenith, and then we called the manager to come and differentiate between the fake and the original. Because the fakers, they are doing it so beautifully. He wasn't able to deflect. He picked the fake one, saying that it's the original. That is a manager from the company. Why? Because the fakers now have advanced. How do you detect fake drug? If you look at the packet, isn't it?
Yes.
Now they are using high chromatography machine to separate the colors, to know the percent of the color, and then they produce equal quality of the original one. So that is another gap or weakness. Next slide, number 3, inadequate data and information system. Yeah, even though we have the National Health Supply Chain System, HLMIS, but with that even, there is a weak information because the HLMIS is only tracking public program, even though now there is a move to include essential medicines. I think they are piloting it in 3 states, Kaduna, Kano, and Lagos State. So they are piloting, integrating essential medicines into the National Health Information Management System. Once they do that, then we'll now have access to more information. But before then, there's a weak data related to that. And then in most of our public sector, it's manual inventory and logistic system that we are using. So there is a need to shift from manual to digital. Even though some states have made that move to shift from manual inventory into an electronic inventory, and it will help us greatly. And then poor visibility into stock level. Across the country, there is no state that has visibility between the central medical store and then either the zonal or facility. For example, in Kano, we have central medical store, we have 4 zonal store, and then we have individual facility. But we don't have visibility from the center to the zones and then to the facility. And until we have that, before we say that we have a very good visibility. Even though now that foundation is supporting 3 states, Kaduna, Kano, and Lagos State, to create that visibility. For Kano, we had a meeting yesterday. The partners have come. We sat down, we had a meeting, how they are going to create that visibility. It is very important. If you don't have visibility between the center and the middle, and then the lower stream, so you don't have much to say. And then lack of real-time logistic information system. Real-time logistic, even with the National Health LMS, it's not real-time because the facility will do manual, keep the record, and then they will not come by monthly to come and now enter that information from the manual into the LMS. What is supposed to be in real time at the facility, while you dispense drug, then it should just be there. You should update the inventory, and then everybody should visualize that. Right from the national, the state, the zone, and then the facility. So that visibility should be there, but we don't have that. Even though, as I have said, plans are upcoming. And why do we have all this achievement is because of we were able to develop a national health supply chain strategic plan. And that is what is helping us to improve. But before that, our supply chain and logistics system is very poor. So, number 4, forecasting and poor forecasting and procurement practices. With the evolvement of DMS, we have now increased our capacity, our skills in terms of forecasting and quantification, and even procurement. That foundation is supporting, again, 3 steps, Kaduna, Kano, and Lagos, to do what? To improve our procurement. There is UNOSIF, Central Institute of Procurement. So they were in 3 states, also Nasarawa State, Kaduna State, Kano State, and Lagos State. They are working very closely with the state to improve our capacity in terms of supply chain. If you see our young pharmacists now embedded in that area, what they are doing in terms of procurement is wonderful. I have a pharmacy not more than 3 years in graduation. He is able to do analysis. They are what we call ABC analysis, Pareto analysis. He was able to do a supplier mapping. He was able to do supplier stakeholders analysis. He was able to analyze even our commodity to see what are our critical commodity, what are our strategic commodity, what are our leverage commodity, and what are our bottleneck commodity. Once you know that, then you should be able to plan your procurement, and then not to waste your time on product that doesn't carry high value and they don't have high risk What do you mean by high risk? Meaning there are many suppliers that can supply you without commodity. So why wasting your time in trying to solve the commodity? You now look at commodity that has few suppliers and that carry high value. Then you now concentrate and make them available while you leverage on the little time that you have across other commodities. So still they are doing that in most of the states, and that is good. And then next is delay in drug procurement cycle, especially in public programs. In public programs, there are those delays. Why? Because most of them are donor driven. But thank God, with the involvement of the DMAs and then our essential medicine program, which is the drug removal fund program, now we were able to fast track procurement as when due. Then next is storage and distribution challenges. Earlier I mentioned that about 23 states benefited from farmer grants, even though 18 are completed. The remaining are ongoing. So now we can both of having a very good and effective warehousing system. But before now, we don't have much. If you go to our warehouses, you will not believe that. How can drugs be kept here? But thank God now with the involvement of the system. Then with collaboration between government and private sector, as I have said to them, now there is that PPP MOU that Act is strengthening. They are connecting the private sector and then the public sector in terms of procurement. Then number 6 is inconsistent funding and financial management. You know, in private, even in private, there are weak funding sources. You see farmer groups go to bank, get loan, and then the interest rate almost 23%. Imagine, that is why cost of drugs is being so exorbitant. But this present government, like what they call always the value chain. President Bola Tinubu has earmarked many $100 million to support local manufacturing so that we can bring down cost of drugs. In the public, most of the DMAs that we have now, they don't have enough funding to sustain the procurement and to sustain to be able to supply the state. And then number 7, human resource. I have said that there are shortage in human resource for health, more especially shortage in training pharmacists and logisticians. If you look at on yearly basis, how many pharmacists are being produced? Before now, how many even universities offer pharmacy? There was a time it's only 3 universities across the country that offer pharmacy. Ibadan, Zaria, and Isuka. But now, thank God, we have many universities that are offering pharmacy. And that is why now more pharmacies are being produced than before. And then that is why KSN is concerned about PYG, so that your capacity should be enhanced. You should know what you should do so that you uplift the pharmacy profession, so that the nation will have quality, access, and affordable medication. And then heavy reliance on donor support for essential medicine and other supply chain activities. There is that across the country, we solely depend on donor support in terms of logistic activities, implementation, and in terms of procurement of health commodities. And that is very bad for the system. We have seen the effect. When Trump comes back now as the president of the USA, what did he do? He said USAID abolished. So most support for USAID abolished. It was later on, you know, HIV, AIDS, and malaria continue. But other support has gone. And then that is why we are now saying that let every state develop a strategy that you will be funding your supply chain activities. And the only way you can achieve that is you have a robust drug development fund. You know there are little map up there that will be able to finance that. In Kano, now most of the supply chain activities are being funded by the state. And the state, not extra money are brought to the state, but from the system, from our drug development fund system, we have a little map up that we keep aside, and then it was able to turn around millions of naira that will enable us to implement supply chain activity. Right? Wow. Okay. Next slide. Okay, high cost of logistics. I have mentioned that poor road infrastructure, increased transportation and delivery level. Then number 10, lack of supply chain resilience. But with our national supply chain strategic plan, we are able to achieve this now. Next, okay, what are the strategic roles that your pharmacists should play? Number 1, data-driven logistics and decision making. Whatever decision you are going to take, let it be based on evidence-based. That is, you should have data for that. And then again, number 2, advocacy for policy reform. You should advocate. We were able to advocate at the national. That's why we developed the national data guidelines. We developed the national supply chain strategic plan. We developed and we reviewed the national drug distribution guidelines. All those policy documents should be there. And then promotion of good distribution practices. Wherever you are, try to promote good distribution system. And then number 4, championing digital transformation. That one we don't have problems for that for now. We know that most of you now they are fast in digital transformation. So that is very good. And then strengthening last mile delivery. That is moving commodity to the last mile and more especially in an integrated manner. It's also very critical. And then quality assurance and pharmacovigilance. That is the area where we are not doing very well. Let's try to put more effort in that. And then next, and then leadership in supply chain. It is very important, very critical. Wherever you are, be the leader of that supply chain. You know, if you're in a hospital, if you're in a community pharmacy, if you're in an industrial pharmacy, take leadership of your supply chain. And then capacity building and peer learning. So peer group learning is very critical, and then capacity that are building. Then entrepreneurship and private sector innovation. It is also important, and then collaboration with development partners. That is also very key. Next, and then now, what are the practical examples for this? Then research and development. It is very important. Under research and development, we have clinical trial involvement, we have real world evidence, we have formulation and drug delivery innovation, and then number 2, regulatory affairs. We should involve ourselves in what? A review and interpretation of guidelines, in product dosage preparation, in pharmacovigilance and risk management, and then in policy advocacy, and then number 3, ethical marketing and medical affairs. We should be able to do the medical science license, and then detailing and educational campaign, and then market access and pharmacoeconomics, and then brand development and promotion. All these are things that will add value. Number 4, joint intervention, such as health campaign and then capacity building. That is very critical. Next, what are the impact of those gaps that we mentioned earlier? Number 1, increased cost of medicine. We know how medicine costs are now being increased annually. Then number 2, stock out and shortage. We know how stock out was able to hit our system. And then number 3, inequitable distribution of drugs. But it's not because of the damage that we have now. Before, if you go to a state that doesn't have damage, you see, within the metropolitan, drugs are available. But if you go at the rural areas, you find that drugs are not available. With the direct system now, you see that there are equity in terms of drug distribution. No matter how remote a facility is, you see that there are quality drugs because of the quality of the direct scheme that we are having. And then number 4, circulation of substandard and falsified drugs is another impact. And then number 5, wastage and expiring of medicines. That one is also there. And then number 6, good integration with healthcare delivery. So now overall, next, what are those? How do we help them? Number 1, full implementation of the National Health Supply Chain Strategic Plan. Number 2, full implementation of National Drug Distribution Guidelines. Number 3, either adoption of the national DRS model that was developed. And then number 5, a stronger logistics system. Then strengthen regulatory enforcement, support local production capacity, digitalize inventory and tracking, and then public-private partnership and distribution. So these are what the country is now focusing. And then as a young pharmacist, you should look into that. This is just the DRS model. We don't have time, otherwise we could have explained it. This is the DRS model that has been developed, and that's what is being implemented right from KB, Sokoto, Zamfara, Katsina, Kano, Kaduna, Jigawa, Yobe, Plateau. In all the 24 states across the country, they are implementing this model. Even though there are some specific variants between one state and another state, but overall, the core model is the same. And we were able to develop this model based on 3 key areas. Number 1 is legal framework, legal framework and governance. Number 2, supply chain operations. Number 3, financial model. Thank God that now our pharmacists are very good in financial management, unlike before. And then the financial management is there is accountability and transparency in terms of all those finances. That is the model we have developed. Next slide. And then it was proven that the data system, any state that has a remote data system, that state will have availability of health commodity. Because the data can supply what we call internal market operation, meaning the data can supply all consumables to the service unit. Number 2, the data can supply national health insurance scheme client across the state. Number 3, the data can supply the state health insurance client. You know now, there's the development of state health insurance agency. So it can supply drugs to that. Number 4, create health care provision fund, which is a national program. The data can also supply drugs to that. And then out of pocket, that is a patient that is not enrolled in either national health insurance, state health insurance, based health care provision fund, that client can get his commodity through the data system. And then for rapid response, that is very important. A state that has a remote data system, you see that for any pandemic, for any epidemic, for any rapid response needed, it can respond. Recently, there was a trailer that carried petrol along Woodley Road. It fell down. People rushed to come and get petrol. About 98 people born, severe burn. Within 30 minutes, drugs were deployed to the facility that the government said those drugs should be there. The patient was there. Why? It's because DRM is working. So, if you remember during COVID, we thought that Kano and Lagos will be the most heated because of our population. But Kano and Lagos were not the most heated. If you look at the chart, why? Because we have a robust drug revenue fund. So even before the COVID, we have our commodity. So when COVID comes, it does to deploy those commodities where they are needed, to the isolation center, and patients were treated. So by and large, these are the gap of our supply chain across the country, and you have seen what do you need to do, what are we expecting from you to do to fill those gaps, and we have given you a practical example of such gaps, and now we are able to showcase the data model to you. Because the data model, whether you are a hospital pharmacist, a community pharmacist, a nursing pharmacist, it is very key, it is important for you. Next, this is just to show you the rating matrix in supply chain. That for every setup, there are people that are responsible, there are people that are accountable, there are people that are consulted, and there are people that were informed. Please, as a young pharmacist, try to understand the rating matrix in supply chain. Because it will stop us fighting. That this guy wants to take my job, this guy wants to come into my territory, this guy wants, no. If you understand really what is my role here, am I responsible? Am I accountable? Should I just be consulted? Should I just be informed? It will support us greatly. Thank you very much. Thank you.
Thank you so much. Wow. Please, can we give it up once again for the pulmonary pharmacist? Thank you so much.